I think the conference is a great place to learn about so many beneficial aspects of psychedelics, how they can foster insight, growth, but also fun for so many people. However, I won't spend any time on, or at least not much time on those aspects today. Instead, I want to talk about cases where this promise wasn't fulfilled. There's a quote by a German pharmacologist, Gustav Kuczynski, that roughly translates, "A drug that is claimed to have no side effects is under a strong suspicion of also having no primary effect." Psychedelics are extremely powerful substances, and that makes it not only plausible, but kind of expected that for some users, these effects might be negative. It really seems to me like two sides of the same coin. And I'm not only talking about the acute challenging experiences during the trip itself, but also rather long-term enduring effects. And those longer-term enduring difficulties, that's what I want to focus on today. So in recent years, several survey studies have asked psychedelic users about long-term challenges. In an unselected sample of psychedelic users, it was observed that around 4.5% of people who had used classic psychedelics had difficult or distressing experiences lasting more than a week. And not very surprising, among those psychedelic users who had already a difficult acute experience, the numbers of post-psychedelic difficulties are much higher. 1/4 of people reporting on their worst best trip with psilocybin said symptoms lasted over a week, and 10% said they persisted for more than a year. And in another study focusing specifically on extended difficulties, they found that 3/4 reported symptoms lasting more than a week, and 1/4 experienced them for over a year. Here you see a list of symptoms that have been reported in those studies, and this list includes anxiety, depersonalization, derealization, changes in how you think about yourself, others, and the world. And having a clinical background and doing PTSD therapy for many years, I couldn't help but notice striking similarities between some of those experiences described and the typical symptoms patterns of PTSD. In all the earlier studies that I presented, they kind of documented a wide range of symptoms across participants, but to my knowledge, none had looked into whether some people might actually meet all the criteria for a PTSD diagnosis, and that's the question that led us to this study. Since it's very central to our study, I want to take a minute to define post-traumatic stress disorder, or PTSD, as a term is sometimes colloquially used rather differently than we would use it clinically. According to the DSM-5, the most widely used classification system for mental health disorders, we only call post-traumatic mental health problems PTSD when those problems show a very specific pattern of symptom clusters after experiencing a traumatic event. And these 4 clusters are A, intrusive memories. And intrusive memories are unwanted and distressing memories. People may experience flashbacks that make them feel as though they're reliving the event. Cues that resemble the traumatic event may also cause intense psychological distress or more marked physiological reactions. We have avoidance of memories, thoughts, feelings, people, places, or activities that remind the person of the traumatic event. We have negative changes in thoughts and emotions. These can include a pervasive negative mood, such as fear, anger, guilt, or shame. Feelings of detachment from others, an inability to experience positive emotions, and persisting exaggerated negative beliefs about oneself, others, or the world. And we have the 4th part of the cluster, hyperarousal. This refers to be easily startled, irritable, often with angry outbursts, having trouble sleeping, or feeling constantly on edge. It's like being in this heightened state of alertness, even when there's no immediate danger. And these symptoms need to last for more than 4 weeks and must cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So in our study, we wanted to find out, can certain challenges after psychedelic experiences actually be considered a form of PTSD? And if that's the case, what exactly constitutes a traumatic event in these situations? How does the intensity or content of a psychedelic experience relate to the issues reported later on? And which strategies did people use to find relief and what worked for them? So to answer those questions, we designed an online survey. It was available in English and German language, and it was aimed at people over 18 years who had previously used psychedelics, and we included the classic serotonergic psychedelics like LSD, psilocybin, DMT, but also some substances like MDMA or ketamine. And people had to have encountered at least one challenging or traumatic experience with psychedelic, which continued to burden them even after the acute effects of the substance had subsided. So importantly, the sample was not addressing all users of psychedelic substances, but at the subgroup who continued to face difficulties after their experience. So we asked questions about demographics, aspects of setting, the acute experience, post-acute problems, therapeutic attempts, and also we had a focus on post-traumatic growth. So the present analysis includes the 243 participants that finished at least the PTSD section of the survey. And the mean age of that group were 38 years. And as in like many of the surveys that are being conducted right now in the psychedelic field, we had more male participants in our sample. Most participants were from Germany and the US, followed by UK, Switzerland, and Austria. So let's get straight to the main question, and I'll guide you through the figure here so that you understand what those numbers mean. In our sample, 98% of participants reported any PTSD symptoms. And this was really what we expected because we only addressed those people who had like ongoing problems after a challenging acute experience. We had 78% of people who reported one symptom of all of the 4 PTSD clusters. And we had around 56% of people who reached the cutoff of the questionnaire that we used to assess PTSD symptoms. This is 33. So 56% of people had like a symptom load that was considered like clinically relevant. 54 of those people had the cutoff and also additionally all 4 clusters. 44% had symptoms from all clusters, reached the cutoff and also had a duration of symptoms of more than 1 month. And then finally, we have 31% of participants that had all the 4 clusters, the cutoff, the duration of longer than a month, and also reported to have been suffering from the symptoms or had a functional impairment. So when I refer to the PTSD group in the following slides, this is the group I'm talking about. However, it's important to keep in mind that the non-PTSD group, so the other 70% in our sample, were not unaffected, but they didn't meet the full diagnostic criteria for PTSD. Looking at symptom duration, we found that for most participants, symptoms lasted well beyond 1 month. Half of the sample reported symptoms lasting more than a year, and 18% experienced them for over 5 years. So you might ask yourself, but what was traumatic experience. And that is what we asked the participants. So what was the most distressing part of the experience, the part that caused suffering afterwards? And we provided 4 options that we had previously identified as potentially relevant. And most participants said the psychedelic experience itself was the most distressing part. For example, feelings of dying, losing control, or fear of going insane. The next largest group said the painful memory resurfaced during the experience, and those memories were what caused their later distress. And very interestingly, in this subgroup, 38% actually recalled a sexual assault, and 45% of people that had painful memory resurfacing said that they had no previous memory of the event before taking the psychedelic. And also very interestingly, the average age at the time of the remembered event was different in the group that had previous memories compared to the group that had no previous memories. So the people that did not have a previous memory of the event had like an event where that had happened when they were like very young, with a mean age of like 6 years. And the people that said they remembered an event that they had already remembered before said this event was happening when they were around 16 years. So in our group, only a very small percentage of people said that their post-psychedelic suffering was primarily caused by an external event that occurred during the psychedelic experience. And in terms of the perceived danger, 1/3 reported a reduced perception of danger during the acute psychedelic experience, while 44 reported an increased one. And in retrospect, like around 1/3 rated the situation as not at all or only somewhat dangerous, while like around 38% rated it as very dangerous. And when we looked at what the events were that were described, it were not like typical traumatic events. Many describe perceived interpersonal threats, such as a threatening behavior from others who were also under the influence of psychedelics. What substances were involved in the difficult experiences? The majority of participants reported using LSD and psilocybin, which makes sense as they are the most widely used psychedelics. However, we did not observe any significant differences between the PTSD and non-PTSD groups in terms of specific substances used. Interestingly, about 1/3 of the participants, this is this bar, reported using multiple substances, often combining a classic psychedelic with a cannabis. So LSD and cannabis at the same time being the most frequent combination. And looking at the reported dosage, only very few participants reporting having such intense experiences after taking a very low dose. At the same time, however, it doesn't seem necessary to take an extremely high dose to experience lasting negative effects. So we actually find cases around all dosages. And we found that those long-lasting problems occurred in both inexperienced and highly experienced users, though the proportion of people who later developed PTSD was slightly higher among those who had never taken psychedelics before. I know those numbers can sometimes feel a bit distant, so I'd like to share also a few examples of how participants described the post-psychedelic suffering in their own words. And I brought some examples from the free text sections of the survey. It's now been 3 months since my retreat. I continue to have constant anxiety with consistent flashbacks. My anxiety shows up as claustrophobia, I can't wear necklaces or tight clothing, an inability to breathe, like something is sitting on my chest, overheating, a feeling of panic, constant intrusive thoughts. I will flashback and be back in my journey 1 to 3 times a week. I'm having fewer nightmares, but I still do have them. Another person said, I suffer from severe anxiety and derealization, depersonalization, dissociation. Several times a day for the past 7 years, I feel as if I'm again experiencing the ayahuasca ceremony. I feel as if I'm in a different dimension, away from everybody around me. It happens mostly when I think about the event, or when I hear music, smells, or conversations about ayahuasca, or of different dimensions, etc. It seriously impacts my life, and I can't do the things in my life that I wish to do. Another person says, I had horrible flashbacks. I cried a lot and felt very distant from people. I was easily triggered into tears if something happened in my family or my partner. I re-experienced the experience and kept wondering why I had to go through that. I could not make sense of it all. And even though I took support and talked openly with my partner and friends, the flashbacks kept happening and I felt very horrible. Panic attacks, social anxiety, dissociation and derealization nightmares, existential confusion about my identity and meaning of life, depression and loss of social abilities, fatalism, suicidal thinking, fear of permanent damage, substance abuse, alcohol to mask symptoms. And my last example is from a person who reported to have recalled memories of early childhood abuse. In the 2 months after recovering the memory, I experienced the following: near constant flashbacks, traumatic nightmares, the recovery of countless other traumatic memories, nausea, vomiting related to shame, restlessness and insomnia, panic attacks, paranoia, an impending sense of doom, random bouts of crying, random bouts of euphoria, spiritual openness, and constant terror. I ended up going to inpatient treatment for 2 months, which in many ways saved my life. So we were also very interested in to see how those post-acute problems related to the acute psychedelic experience. And what I found was a strong association between the intensity of the challenging experience and the later distress. So the more difficult the acute experience, the more PTSD symptoms were reported afterwards. But you all know psychedelic experiences are complex, so we also took a closer look at the acute experience and examined the role of avoidance and acceptance related aspects using the APEC questionnaire. And here you can see some example items from the APEC questionnaire that illustrate what I mean with avoidance and acceptance related experiences. So it's a bit complicated, so I'll explain the figure a bit. So the more avoidance participants reporting during the acute experience, the stronger their PTSD symptoms were afterward. Conversely, the more acceptance-related experiences they had, the fewer PTSD symptoms they reported. There was, however, no significant interaction between the two predictors. But we didn't just want to look at post-traumatic distress, we were also interested in post-traumatic growth. And across the whole sample, many participants reported aspects of learning or personal growth following the experience. Interestingly, we found no significant association between the intensity of the acute challenges and post-traumatic growth. So in other words, a difficult trip alone doesn't predict growth. However, there was a very strong positive link between acceptance-related experiences during the trip and later post-traumatic growth. So the more acceptance participants experienced in the moment, the more growth they reported afterwards. Avoidance-related experiences, on the other hand, showed neither a strong positive nor negative association with post-traumatic growth. And I think that's an interesting finding, as it challenges a little bit the common notion that all challenging experiences are ultimately helpful. It suggests that it's not the difficulty of the experience itself that matters, but how it's processed. So growth appears to fall a little bit more after acceptance and not avoidance. Finally, we also asked participants about the types of supportive measures they had tried and what they had found helpful. Talking to friends and family, as well as searching for information about their symptoms online, were the most commonly reported strategies. However, only 12% found internet-based resources very helpful. And this might suggest that simply reading about your symptoms or how to deal with your symptoms isn't enough, or that the existing online materials aren't tailored to the specific needs of this group. The most helpful therapy approach reported was psychotherapy, and among the participants who met the full PTSD criteria, 70% had tried psychotherapy, which for me was actually great to see, and I didn't expect that, especially considering that psychotherapy is a first-line treatment recommendation by most international guidelines for PTSD. So let's summarize a little bit the most important points. So challenging psychedelic experiences can lead to severe psychological complications and long-lasting post-traumatic stress symptoms. The traumatic event can be the psychedelic experience itself, traumatic memories recalled during the experience, or external events that occurred under the influence of psychedelics. The more acutely challenging the experience, the higher the PTSD symptoms. Post-traumatic growth, on the other hand, was not associated with the intensity of challenging experiences per se, but linked to acute acceptance-related experiences during the psychedelic trip. And most people sought help by talking to friends or family or by searching the internet, and around 70% started psychotherapy. Why are these findings important? When we advertised our survey, we received many comments along the lines of, I've had many experiences with psychedelics and they all went fine. You're exaggerating the problem. And yes, it's true. The vast majority of psychedelic users will likely never develop psychedelic-related PTSD. But that doesn't help the ones who do. And this is not about labeling or pathologizing normal processes of integration or adjustment. It's, to me, more about recognizing when people are generally struggling and finding ways to support them more effectively. And by understanding the nature of post-psychedelic difficulties, we can offer better or more appropriate care. And also the field of PTSD research has developed over decades now and provides a solid foundation of knowledge and therapeutic approaches. So these can offer valuable tools for addressing psychedelic-related trauma. If we name what's happening, it becomes maybe easier for people to recognize their own experience, to feel validated, and to access help that's specifically tailored for what they are going through. The gold standard right now for PTSD treatment in most guidelines is trauma-focused therapy. And while there are many different methods, what they all have in common is that we work together to revisit the experience, to understand it and make meaning of it rather than to avoid or suppress it. Yeah, this brings me to the end of the presentation, and I'd like a moment to thank the entire team who contributed to the project, and Abdu Uya, who is also here today. He will continue to explore the qualitative part of the survey in more depth as part of his PhD project.